Welcome to the Kara's Care Show, where we explore the cutting edge of wellness. I'm Kara Sundlin. Thanks for being here. You know, when women lose our hair, it can be so traumatic. Not that it's not for men, but almost extra for women. So I am joined by Dr. Mary Wendel. She is the founder of the only medical practice in the Northeast devoted exclusively to female hair loss. And she's here to tell us, separate some myths from what actually works to reclaim your scalp and your hair health. So thank you, doctor, for being with us.
Thank you for having me.
Let's first talk about this. It's a little bit different for female hair loss. I know, hey, my husband would say, I don't like losing my hair either, but it is something different for women. We don't talk about it as much, and it's quite traumatic.
It really is. Women are very self-conscious about their hair, and it's hard for them to talk about it to strangers, even to their friends. It can be extremely traumatic, and so it tends to get pushed under the rug and not spoken about because of the emotional component to it.
Is it common for women to be losing their hair?
It's extremely common. Statistics claim that 50% of women at some point in their life will have hair loss, when in fact, I think that the number is greater than that. Once women get past their 50s and 60s, it's not completely universal, but most women who are 60 will tell you they don't have anywhere near the hair they had when they were 30. So it's extremely common, and it can occur at any age. I mean, we see young teenage girls coming through the door, and I also am treating women in their 90s. So it's across the board.
So what causes it? Is it generally one thing for women, or it could be a multitude of things?
It really is. It can be multifactorial. There are certainly the most common causes are what's called androgenic alopecia, which is what occurs with aging. And also there's a genetic component to it. That's by far the most common, but there's also many other potential causes of hair loss, including diet, nutritional, there's some inflammatory and autoimmune disorders. There's a fairly long list. And so it's not always so simple to just say, well, I'm getting it because my grandmother lost her hair or my father lost his hair. It's not always genetic, but there are many factors that can play into it.
Yeah, including hormonal changes. I think a lot of us remember, losing hair after birthing a child, or it can happen again in menopause. And we saw lots of people, myself included, losing hair after we got COVID. So lots of different things can cause hair loss.
Yes, many different things can cause hair loss. For women, of course, the hormonal piece of it is huge. The majority of our patients are perimenopausal or postmenopausal, and those hormonal changes do play a role. Yes, losing hair after pregnancy is very common. We've seen an incredible amount of hair loss in the last year with COVID. So whether it's the stress, the illness, all of the above, it can play a huge role. Diet is incredibly important for hair health. And so we see a lot of younger women who aren't necessarily eating a healthy diet coming in with excessive shedding and hair loss. All of that plays a role.
So tell me a little bit about why you decided to really devote your practice and all of your research specifically to this.
Well, it was really an interesting journey for me. I do have female hair loss in my family. My grandmother wore a wig, which when I was little, I thought was kind of cute, but she obviously was very sensitive about her hair loss. She would wear it when she would go out. So it was already there in the back of my mind. And I did primary care for many years, but it's something I was drawn to as I started to see my own hair beginning to thin perimenopausally. And I realized this is something that was important to myself and to a lot of women around me, and needed a bit more investigation and treatment options for women.
Well, and that's the thing. I have friends who have struggled at any level, just losing a little hair to really having problems and thinking, I've asked, there's nothing really that helps. Is that wrong? Are there treatment options that can really make a difference and we just don't know about them?
Yes, there really are. And that's the sad part, is that a lot of women go for years thinking there was nothing they could do about it, when in fact there are some options. There is treatment that helps. And we can not only stop loss, but we can, in many cases, help regrow what has been previously lost. And it's so important for treatment to start early. The earlier treatment starts, the greater the success that we have. And there are many different treatment options available. They vary in cost, they vary in intensity, and we can usually find something that works well for someone in their particular level of hair loss. So there's a lot of options out there. And the sad part is people don't realize it, and women wait a long time. We actually did a survey in our office, and we found that on average, women wait up to 5 years before they seek help.
Wow.
You know, they know there's a problem and they don't know what's out there. They start looking, they feel embarrassed. I can't tell you how many women come in, they break down, they cry. It's a very emotional problem, and they're embarrassed to come in, which is really sad, but it keeps them away. And there is treatment and there is hope, and there's more treatment going on all the time. There's more treatments today than there were 5 years ago. So the research is ongoing, which is exciting, but we just need to get that message out there.
So you are the founder of MediTress, that is located right here in Connecticut, the only medical practice in the Northeast dedicated exclusively to female hair loss. So tell me about some of the treatments. What's one treatment that you're having a lot of success with?
Well, generally, depending on the cause, and that's very important, is getting a good evaluation from an expert and determining the cause. And so the treatment will depend on the underlying cause of the hair loss. But some of the newer treatments, of course, a lot of people know about minoxidil or Rogaine, and we still use that, but it's now available orally, which really works better, in my opinion. So that's something that's actually just in the last couple of years, we've been using it more. There are treatments such as light therapy, which does also help. There's been more research to show that low-level light therapy does help, and there are different forms of that people can purchase and use at home. We do treatments, something called PRP, or platelet-rich plasma, which is our own blood products, which have filled with growth factors, which help stimulate hair to regrow back. So there are a variety of options available. We now have a painless form of PRP because there is a little bit discomfort associated with the procedure, but we now have a painless form, which is, in my opinion, it works just as well and considerably less discomfort. So we're excited about these changes, many of which have been just in the last 5 years. And there's so much more research to support their use.
Yeah, and I think I said you were in Connecticut, actually just over the border in New York, but easy for Connecticut folks to get there. And you have 5 locations, actually. But let's start with PRP. People may not know what that is, platelet-rich plasma. I've actually watched it be done. Why does that, describe to someone what that process is and why some people have a lot of success with it?
Platelet-rich plasma utilize your own blood products. So it starts with a simple blood test, just as if you were in your doctor's office getting a blood test done. We spin the blood down and separate it, and we are able to find that layer of blood, which is filled with growth factors. There are dozens of different types of growth factors within our own bloodstream, which help with healing when we are injured or sick. But we actually separate them, and then they are infused either with injections or, in our case, painlessly under the scalp into the area where the hair follicle is. And so it stimulates our own stem cells that are there to do their job, to help the hair regrow and to thicken. I will tell you that greater than 90% of women who have PRP treatments will have benefit. And by benefit, I mean their hair loss will slow down and usually stop, and they can get some regrowth of the hair that they've already lost. So it's really a remarkable procedure. It's virtually painless, or it can be. Most women will have benefit from it. It's something that's been, we have actually improved the procedure and made it, again, it's painless, it's more specific to each individual. And so it does work. It's just using your own body's healing properties to stimulate regrowth.
You mentioned diet a lot. What specifically should we be eating, or are there supplements that you're prescribing for folks that you're really seeing help?
Yeah, supplements, it's interesting. When I was sort of in a general medical practice, I wasn't a big supplement person. I didn't push it unless under very specific circumstances. But what we have found in the office is that supplements can help. Sadly, the diet in this country is terrible, and there's not as much nutritional value to what we eat. Even if we eat a really good diet, the nutritional value is diminished compared to 10, 20 years ago. So if we supplement it, we will get the nutrients that we need to supply our body with healing properties to help the hair grow. So we have our own line of supplements, and we specifically cater to hair loss. And so the things that are in our supplements are specific to what hair needs to grow healthy. You know, vitamin D is important, iron is important, magnesium, zinc. The list is very long. In terms of diet, it's important to get enough protein. It's important to get a well-balanced, as much as possible, non-processed diet, so that we get the nutrients and without all the additives that can be harmful.
Yeah, absolutely. And certain medications also can really affect our hair loss. Is that right?
Yeah, certain medications can. We're very careful about screening patients. A lot of our women come in already on a lot of medications, and so we're very careful about what can help and what can hurt. Most commonly, it's not a big deal, but it's important to take that history when somebody comes in with hair loss.
So is it different for women than men as far as how we fix it and why it happens?
It is different. It's not completely understood all the reasons why women lose hair. There is certainly hormonal effects to it. That's huge. And with men, it's primarily testosterone. And so there are medications that are available that work incredibly well, but they also utilize laser therapy and PRP. Men have the option of transplants, which work well for men. They can work well for women too, but women are looking for denser hair. And so we're very selective about who we choose to do transplants on. It is a potential treatment that's available, but we tend to be very selective. But the treatments are not that different. Men tend to jump more towards surgery with hair transplants.
Okay.
But generally, they also can use light therapy. They can use oral minoxidil. A lot of the medications that work for men can work for women too. The dosing is a little bit different, but there's some commonality there. Genetics is a huge part of it. Aging is a huge part of it for both men and women.
Yeah. Well, and I know some guys will say, I don't want to take Propecia. I don't like the side effects. And all it did is give me peach fuzz. It just wasn't worth it. There's nothing out there that's really helping me. I know you've got some great reviews on your website of people saying it was really transformational. But I mean, can you shed some light onto what you do specifically? That you're seeing like the biggest differences with, where a lot of people think, it's maybe not even worth it. I'm going to take this medicine forever and I might get a little fuzz. And that's not what people want, right?
That's correct. They want a significant change. And for women, men too, but for women for whom it's really emotional, they want to feel more confident. They want to feel more like their old self. And so, yes, we're looking for more than just a little bit of regrowth. We're looking for some significant changes, and we've been successful. It's a combination treatment that works best. We know that it's additive. One, starting minoxidil or some other medications, some hormonal changes can be treated. We'll start the process, but adding treatments to it, laser therapy, PRP, it's really additive. And so we try to encourage women to understand that, yes, this process, we can't cure it, but we can treat it. And so you have to be patient and understand that it's an ongoing process and you have to stick with it. And so we do screen women carefully for how committed they are to treatment and their understanding of expectation. But you're correct. We're not looking for just a little bit of peach fuzz. We're looking for improvement, significant improvement.
Yeah, and so that, I guess the difference is you're going to, having seen many patients, you kind of know what's worked the best. And if you went to a place like MediTress, it's going to be a personalized program, much the way you would get a personalized trainer. Your diet and your working out might be different for your body type. You're gonna do testing, or what would happen so you know exactly the best protocol for a woman?
Yes, we're very thorough in our evaluation, and that's the advantage of coming to a place like MediTrust, where we have medical clinicians who are all trained in this specialty. And we start with taking a good medical history, a good hair history, review medications, review your past medical history, surgeries, everything that can play into this. In the last 3 years, have you had COVID? When did you have COVID? What kind of reaction did your hair have when you were sick? All of these things are very important, and we take a very careful history. Medications, supplements, what are you taking? What is your diet? What are you eating? What are you not eating? And so that's the first piece, is the careful history. We then do a careful exam. We review, we feel the hair, we check the texture. We actually have a machine called a trichoscope, which magnifies the scalp. We can see the hair follicles. It helps us determine if there's inflammation, if there's any evidence of immune diseases, is there scaling, is there redness? We can actually make the diagnosis most of the time by just getting that close magnified look. So that's a big part of it. And so then we do sometimes do blood work. It depends again on each person. Each person is different. They come with a different set of problems. So we might check some nutritional values, some vitamin levels. Sometimes we do hormonal levels. Again, depends on the age of the woman, what her status is in her life. Is she premenopausal, postmenopausal? Is she postpartum? That's so huge. So many women come in, their hair is just falling out postpartum. So depending on their hormonal status, we sometimes will do hormone levels. We'll check estrogen, progesterone, and testosterone. We know testosterone drives hair loss in men. It drives hair loss in women sometimes as well. So we have to do that thorough evaluation, both clinically examining and sometimes doing blood tests. Once we do all of that, we're pretty sure what's going on, and we know next what we need to recommend for treatment.
I'm just looking at some of the pictures on your site, and there are some, if someone isn't going to make it to MediTress, which I know you would recommend a consultation or something to get personal, but there's billions of dollars, I'm sure, being spent. We go to the drugstore or the hair salon, and it says thick hair, anchor, there's even something called anchor hair people buy. You have some specific products on your website. I don't know if you know, could you tell the average person like certain things that actually work, and is anyone able to buy some of your things, or it's only if you're under your care?
Yeah, it's frightening. I walk down the aisle in the pharmacy and I look at all the products, and I don't know how anybody can make sense of it. And so a lot of it is just advertising. They're trying to convince you that it's going to make your hair grow better. It's going to make it look better. And actually, we know that there are a lot of chemicals in these products that can actually be harmful to hair. And so we've been very careful to screen out those products and those chemicals, so that the products that we do sell in our office are safe and gentle to your hair and to your scalp. There's no shampoo product out there that's going to regrow your hair. That just doesn't exist.
Doesn't exist. But yet you do have some shampoos on your website, I think, that are MediTrust. So what, just for basic shampoo and conditioner, what matters?
What matters is that it's as simple as possible in terms of the chemicals that are in there. You don't want harsh chemicals. You don't want a lot of alcohol. You don't want as much fragrance. Even some patients are very sensitive to fragrance. And so there are certain fragrances that can be more likely to cause inflammation. And we've eliminated those from our products. Our products really are meant to support what we do in terms of helping your hair stay healthy. And so we've eliminated things that we know can potentially make hair and scalp inflamed. So we've worked hard to sort that all out. And so our products, we do sell them to our clients who are interested. They are available on our website for purchase. So they're safe. It's interesting. We have, quite a few women working in our office. And when we were coming up with these products, we tried them all. I've probably tried every product we've attempted to test over the last 5 years. Most of the women in the office have done the same. So through our own experience and through our own medical histories and what's going on in our own lives, we were able to figure out what works best for women. And again, eliminating those chemicals that we know can be harmful and can get in the way of our treatment program.
Okay. So, and if you're thinking, hey, I want to visit MediTrust, I know for those listeners in Connecticut, it's not a far trip, right? Just right over New York. What happens? Do you go in for a consultation? How long is it? How does it work?
Yep. People call the office, we set them up with a consultation, and the consultation lasts up into an hour. We do the complete history, we do the complete physical, we do the trichoscopy. So we spend a full hour with our patients and try and really get to the core of what their hair loss problems are. Once we do that, we will, for the most part, on that first day, we'll know what treatment plan is best for them. Some patients we have to wait until the labs come back, or rarely we will do a scalp biopsy if we think there's excessive inflammation, and that takes a couple days to get back. But usually by the end of the consultation, we know what's going on and what treatments will work best for them. And so we have an honest discussion with them to figure out what their level of motivation and what their concerns are. What is bothering you the most? And if we move ahead with treatment, what part of your hair do you want to work on? And so again, all of that plays into the decision-making process. The patient is very involved in the decision-making process. Without their input, we really can't move forward.
Yeah, so in general, how many treatments would it take and how long will it take to notice a difference with the treatment plan?
If someone moves forward with PRP, it's 3 treatments a month apart, and it takes about 6 months for us to start to notice visual change. We have them come back, we reevaluate, we take photos, we do measurements. So we know, in fact, is it working or not? It would be unusual not to be working, but we are very careful about that. And so even with laser, if somebody decides they're not ready to make the commitment for PRP and they're doing laser therapy, again, it takes about 6 to 9 months to see that benefit work. We have them come back, reevaluate, do the photos, and make a decision. Is it working? Do we need to add to it, or can we just continue with what we're doing? With PRP, we do the 3 treatments, and then if they're working well and the patient is satisfied, they will need a booster treatment once a year about once a year to maintain that benefit until something different comes along. But for now, it's once a year, a booster treatment to maintain that improvement.
Okay, and I think a lot of people are familiar with laser treatments on our skin. Is it similar as far as the laser working to help rejuvenate you and your hair?
Yeah, it's a different level of laser. I know a lot of women are familiar with laser hair removal or laser skin resurfacing. Those are higher dose, tending to be a hot or a warm laser. This is a cold laser. You don't even notice that you're using it. It goes directly on the scalp, and it's 30 minutes of treatment every other day, and it actually does stimulate regrowth. We do have photos on our website showing benefit with laser therapy as well. So every patient has a different expectation and a different goal in mind. And so these treatments are really individualized for their needs and what their expectations are moving forward. But laser does work. It's really interesting. It's a totally different type of laser. It does help the scalp stay healed. Does have anti-inflammatory properties, but it's a different intensity of laser. It doesn't go very far into the skin, just to the level of the hair follicle. So it's not burning, it's not irritating, it doesn't cause the scalp to be red. It's not a resurfacing type of laser.
I mean, a lot of people are starting to use red light therapy at home for anti-aging or for inflammation. Is there a certain kind of light laser that works for hair that you use?
It's really the intensity. It's the wavelength of light that determines the property of laser and what it does. Yeah, the higher intensity lights, the higher laser, are hotter, and they go deeper, and they cause greater change in skin. The lower level lasers are like what we use, and that's similar to the red light therapy that people are using.
A lot of naturopathic offices are using it for anything from insomnia to inflammation to people are buying them on Amazon to kind of help with their own skin. So obviously, I guess the benefit to going to someone like you is that you've opened this studio and these treatment centers way back in 2015. You've had a lot of experience of what works and what doesn't, and clearly there is new technology coming out every day. So I guess the important message is that there's hope for women out there. What if you want that really thick look? Do you also do the other things? Is there any such thing as a hair treatment that It might be more like a wig, I guess, but it's going to really give you that volume, and it's not going to look fake.
Yeah, we don't get involved in hair replacement. I think most of our clients are really at a more basic level of just trying to prevent loss.
Okay.
We do know very good hair replacement centers that we refer to our patients to who want that extra fullness. And there are some women, when they're undergoing treatment, if there's a special occasion and they want more fullness while they're waiting for their treatments to work, having some extensions or a smaller hairpiece for those special occasions, I think is quite appropriate. And whatever makes a woman feel comfortable is really very acceptable in my mind. In terms of extensions, you do have to be careful, because if a woman has fragile hair and is undergoing treatment, a permanent hair or semi-permanent hair extension that gets glued on or tied in can actually pull on the hair a little bit and make some hair loss worse. So we work with a very specialized type of hair extension product. We refer our patients to that salon, and they know what we recommend and what is safe for that person. So again, you have to be careful, because some of those hair replacement systems can actually
make it worse
in the long run, aggravate some loss.
Okay, so as we come to our close of our time together, where we explore cutting edge wellness, and of course that's why I was interested, because you offer cutting edge treatments for hair loss. But if we can sum it up for folks, if you're listening to this, the one thing that I heard the most from you is don't wait. The sooner you get treatment, the better your results are going to be. So that's great. Don't wait. If you've already waited, is it ever too late?
No, I would say no, it's not too late. It's just that we know that the sooner you come, the greater likelihood of getting that fullness back to where you were prior to the onset of the hair loss. When a woman waits a long time, it's harder to get all the way back to that place. And so, again, we encourage people, the message is come as soon as you notice there's a problem. It's easier to prevent further loss than it is to regrow new hair. We do regrow new hair, but it's easier to prevent that further loss, because hair loss in most women is progressive and it needs to be managed early on.
Yeah. So again, all those treatments you do are scientifically tested. They don't have serious side effects. There's a lot of them. I guess the point is you're going to get it personalized. I want to give everyone the information. It's Meditresse, MEDITRESSE.com. You have a lot of information on your website, including frequently asked questions and your history and why you founded this center. Again, just over the border, people can go to New York City and, or not New York City, but Westchester, but just over the border from Connecticut. So a lot of folks there. We appreciate your time. I know it's a topic that a lot of women want to know more about. So we appreciate you giving us the cutting edge wellness tips.
Well, thank you for having me. It's very exciting to share this knowledge. And again, the message is, get treatment early, don't wait. And we understand how emotional it is, and we're very sympathetic. And virtually every woman that works in my office has some degree of hair loss. So we're very, very in tune to all of that.
All right. Thank you, doctor. And thank you so much for being here. Be well.